Thank you very much, Madam Deputy Speaker. As we move into the second year of COVID, and despite still being in lockdown, there are key positives to be celebrated. The vaccine rollout is progressing quickly, and staff in all 4 National Health Services should be congratulated, along with the Army who have provided logistical expertise and the thousands of volunteers who've helped ensure the safety and organisation of vaccination centres. Vaccine uptake has been way above expectations, and with the hope they will prevent viral transmission as well as protecting the recipient, everyone who rolls up their sleeve is contributing to the fight against the pandemic. However, concerns remain about lower vaccine uptake among certain groups, including some who are particularly vulnerable to COVID, such as BAME communities. Anyone offered the vaccine should take up their appointment, and if they have questions, there's information on the NHS websites, or they can ask their local GP practice. Until now, any increase in COVID cases has led to an inevitable rise in hospitalisation and deaths just a few weeks later. But as more vulnerable groups are vaccinated, this is starting to change. We are already seeing the benefit to those who were vaccinated first in Scotland. An analysis of over 1 million vaccine recipients by Public Health Scotland has today revealed a reduction in hospitalisation of between 85 and 94% for the 2 vaccines. Due to its integrated structure, Scotland's NHS was able to get permission from the MHRA to deliver the Pfizer vaccine into all elderly care homes from the 13th of December. And this has led to a 62% drop in deaths among residents throughout January. And this dramatic fall will hopefully be replicated in data across the rest of the UK in just the coming weeks. As the Prime Minister himself has highlighted, one possible threat to the success of the vaccination programme would be the importation of a more vaccine-resistant variant, such as that which has arisen in South Africa and has already been shown to be resistant to antibodies from those who've recovered from COVID. This threat makes it inexplicable that when the UK government has finally decided to set up monitored border quarantine, it's on such a limited basis. So much for following the science. There should be mandatory quarantine for arrivals from all countries, as there is nothing to stop someone travelling from South Africa or Brazil via a third country. The South African variant is already present in at least 35 other countries, and new variants could be evolving as we speak. The government's suggestion that people will be able to travel abroad for summer holidays seems to be courting danger, as many countries will not be vaccinated and therefore pose an increased risk that holidaymakers would bring back new variants. Surely this is a sacrifice we could all accept if it allowed children to be in school and our domestic economy to open up. This measure must, however, be combined with support for the aviation, aerospace, and international tourism sectors. With regards to the Prime Minister's roadmap out of lockdown, I welcomed the suggestion that decisions would be based on data rather than dates, but he then proceeded to announce a whole list of dates. While it's good to see cases falling so dramatically across the UK, from almost 60,000 to just over 11,000 a day, case levels, however, are still more than double what they were when SAGE called for a lockdown on the 21st of September. And the number of COVID patients in hospital is 10 times what it was last September, and has only just dropped below the peak of the first wave last week. While Scotland has maintained lower case levels throughout the second and third waves, progress in all 4 nations is slowing, and this is thought to be due to the greater infectiousness of the B.1.1.7 Kent variant. Thankfully, this variant appears to be just as sensitive to the immune response induced by current vaccines. But every time the virus spreads and replicates itself, there is an opportunity for mutation and the risk of a problematic domestic variant emerging, including one that might be resistant to our current vaccines. The UK has already faced 3 waves of COVID and 3 lockdowns, and it's important that current restrictions remain until case levels have been driven low enough to give the vaccine programme a chance to succeed and health services time to recover. It's not a matter of setting the economy against public health. It is through stopping community spread that we would be able to get our domestic economy and society back up and running. Once COVID levels have been brought down, it's critical to have an effective system to test, trace, and isolate those who could be carrying the virus, to keep control of the outbreak. Unfortunately, 1 in 8 cases are still not being reached by NHS test and trace, and surveys suggest that as few as 1 in 3 people are isolating when required. The commonest reason is that they can't afford to lose their income. Yet over half of those applying for the government support payment are being turned down, which makes it very unlikely that they would then isolate. The government needs to widen the eligibility criteria and review the level of payment, which is less than the minimum wage. It's in everyone's interest to ensure that those who could be carrying the virus isolate and avoid onward spread. All of these measures carry a cost. But when we see the flourishing domestic economies of the countries that acted quickly and stringently last year, we can see the cost of not taking action, both in lives and economic damage.